السلام عليكم ورحمة الله وبركاته. عملاء كواليتي ليدرز أكاديمي في كل مكان، كل عام وحضراتكم طيبين وبخير، ورمضان كريم أعاده الله علينا بالخير واليمن والبركات. أهلا ومرحبا بكم في هذا الإيفنت المباشر والمهم جدا لكل صيدلي وممارس صحي ومهتم بمجال الجودة وسلامة المرضى. دائما ما يمثل التفتيش الصيدلي تحديا للكثيرين، لكننا في كواليتي ليدرز أكاديمي نؤمن بمبدأ أساسي ومهم، وهو أن الاستعداد للتفتيش ليس حالة طوارئ نعلنها عند وصول المفتشين، بل هو التزام يومي بفعل الصواب. في لقائنا اليوم لن نتحدث فقط عن النظريات، بل سنسلط الضوء على الإجراءات العملية والممارسات اليومية التي تضمن بقاء الصيدلية أو المنشأة الطبية متوافقة وآمنة ومستعدة لأي تفتيش في أي لحظة. ضيفة لقائنا اليوم ليست قامة علمية ومرجعية عملية، تمتلك في رصيدها أكثر من 36 عامًا من الخبرة العميقة في صيدلية المستشفيات، كرست منها أكثر من 22 عامًا لقيادة وتطوير وتحسين الجودة الطبية. نرحب معًا بالزميلة دكتورة فرح شهاب، Certified CBHQ CBBS Risk Management Lean Six Sigma Green Belt، وكوتش معتمد في التحسين الجذري للعمليات، و TOT Certified. أهلًا وسهلًا بحضرتك يا دكتورة فرح، منورانا النهارده.
ألف شكر. Thank you very much for the nice introduction. السلام عليكم ورحمة الله وبركاته everybody، ورمضان مبارك على الجميع. ربنا يجعله شهر الخير ويعيننا على صيامه وقيامه ويتقبل منا جميعا صالح الأعمال. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا وزدنا علما. In this 1 hour session, I would like to go with you in a true experience from what we do in our hospital pharmacy. And it is exactly we're doing, putting ourselves in the shoes of the inspectors and do inspect our areas before the accreditation or the surveyors visit us. So as the title of this session says, what to inspect when you are expecting an accreditation. Actually, it's a pharmacy quick guide to accreditation continuous compliance. So I'm inviting you to share with me this journey. Let's start. First, we would like to explain why pharmacy inspection or self-inspection is important. Having an self-inspection to your pharmacy, it will assure patient safety, improve the quality of the practice of the staff and the area, medication preparation, and make you compliant with the regulatory standards and accreditation readiness. Need to emphasize also that inspecting your areas in the pharmacy, it's not a punitive thing. You are not finger pointing anybody. You are just being ready. You are identifying gaps early enough in order to correct it, to improve the systems you're working with, and maintaining the high standards of care. What we're going to share with you is really a practical experience. You can do that, and it is based on a real inspection focus areas. So let's walk you through the objectives. First, we would like to see what the inspectors would really look for. What are the common gaps and how to avoid them? The intention from all that is to have a daily readiness. It's not just a last minute fix before the surveyors come to our area. We need to ensure that pharmacy operations meet accreditation standards all year round, focusing on patient safety, staff safety, medication process quality, and of course, regulatory readiness. Doing inspections should be a routine process, and it should follow a standardized checklist. And most important, it needs to be documented. When we say inspection, you need to inspect the area. You need to check with the staff knowledge, observe their practice, and again, documentation. We're going to talk in this session about areas in our pharmacy. All pharmacies would have it, which is the sterile compounding areas, storage of medication, working environment, infection control, and of course, the medication safety. We would like to reinforce that if we do these inspections routinely, this would become a stress-free whenever we have the real visits or the real accreditation. So starting with the IV rooms or sterile compounding area, where we have the aseptic conditions running to prepare sterile preparations like the IV admixtures. In the IV rooms, we will have the laminar airflow hoods, which we consider a sterile area. Now, why it is that important? Why the inspectors would focus on this highly during their inspection? Because a sterile preparation, it crosses all natural barriers. It goes direct into the vein. It might cause a serious adverse effect if it, God forbid, got contaminated, and a death could occur. So inspectors give it a high focus on it. What do we need to have when we go to visit the IV admixture room? IV room should have a manual. That's the basic thing or first thing that they would look for and ask for. This IV room manual should have a proper aseptic technique steps documented and updated according to the recommendation of the USP 797. It should contain also all the policy and procedures related to the sterile preparations, a training program to the staff, the newcomers or the annual training, all the guidelines, the calculations done, the stability of the medication, and the description of the responsibility of each staff working in the IV room and preparing the sterile preparations. So this is from the documentation side. Now the hood itself. The hood must be free of the clutter. So when you visit your area, the IV room, you go to check the hood. It should be free from clutter. Like the preparer should be preparing one medication at a time. And there should be no excess items disrupting the airflow coming from the filter. You need to check the hood top, underneath, and behind the hood. It should be also clean. So it's not enough to have the hood cleaned from inside. You need to check the cleanness from top and the bottom. How would you do that? You just take a gauze and swab the top, swab the bottom, and check the back of the hood. It should be clean. Again, cleaning of the hood, you need to watch the staff there, how they do cleaning. Is it proper as the USP 797 says or not? Are they using the proper cleaning solutions? A cleaning log must be there, and it must be complete with no missing signatures. So it is not just the day of the visit. It should be full, no gaps in the cleaning logs. They should fill the log cleaning in the beginning of the shift, in the middle, at the end, whenever they are doing batches or whenever there is a spill, or every 30 minutes. They should do cleaning and they should do the log, and you check this document. Now, the hood itself need to be checked by clinical engineering, and they should provide you with a report every 6 months that they did the preventative maintenance and they changed the filters and they checked everything. A tag is stuck in the hood, at the hood from outside. It tells you when will be the next checking by the clinical engineering. You check this date and it should be in the future. The pressure differential between the IV room and the outside room. If you're preparing a regular steroid preparation, of course, the room inside should be a pressure, positive pressure. And if it is a chemo preparation room, it should be negative pressure. Positive pressure, we mean it should be more than 5 Pascal or 0.02 inch water column. It depends on the device you're using. Again, you need to be recording that. So check the log, check the recording. It should be consistent. And it should be, of course, within acceptable range. If not, they have to call the maintenance, the clinical engineering to come and check. I would like to emphasize here on documentation. Documentation, it's a proof of compliance. Medication fridge. Medication fridges, and we're again emphasizing the fridge should be designed for medications, not like our home fridge that has a freezer and the bottom of the fridge, the medication has a special design. It is not recommended to have the home fridge, use it for medication, because the temperature would be vary from the lower shelf than the top shelf, and people might use the door to store the medication in it, which again, it is not recommended because of fluctuation of temperature whenever you open the door of that fridge. Now, why it's important to observe the medication refrigerator and maintain the temperature sensitive medication stable, and monitor that and document that. Because some medications, they are very sensitive to fluctuation of temperature, and they might lose the effectiveness quickly if they become too hot or too cold. Example, we have the vaccines or biological or other medications. Now, the temperature log itself must be completed on a daily basis, once a day for regular medication, but for vaccines, it needs to be continuously monitored. I hope in your hospital that you would have a centrally monitored medication refrigerators. What does this mean? Centrally monitored, that means all your medication fridges are connected to be to a control work room, that a department or section in the hospital that they keep monitoring the temperature of your refrigerators and inform you if it goes out of range. If that's so, then you don't have to document yourself or write on a daily basis the temperature. For the vaccine, it should have continuous logging of the temperature. It's not enough to have once a day. For vaccines also, it needs to be connected to emergency power outlet, and the emergency power should be labeled as such. And this is something the inspectors would look for and ask you about it. Again, the medication fridges should be clean from inside, well organized, properly labeled, and of course, there should be no personal item there. No bottle of water or leban or ice cream, something, any food or anything. It's for medication only. And things like that might be missed by the staff, and it will be cited, of course. Now, what would happen if the temperature goes out of range? Even your fridge, if it is centrally monitored and you are not recording the temperature on a daily basis, you still need to have a form where to document if the temperature goes out of range. You would write down what is the temperature, what happened, when, what would be the action, how it is fixed, how long does it take. The most important thing here is not the fridge. The most important is the medication in the fridge. What was your action? The action that we remove the medication to the nearest fridge to keep this medication safe. And it depends on the time, how long it was out of range. Maybe it is not okay to use it again, then we separate them, label it, not to be used unless we receive a feedback from the Drug Information Center after they check each item that was in the fridge uh, upon this time that went out of range, if it is good to be used again or not. So the most important thing is not the fridge, is what did you do with the medication. Now, other than storing medication in the fridge, we have other areas. For example, narcotics. Narcotics, of course, need to be stored in a cabinet that are locked all the time when not in use. Should be locked with the steel doors, or a steel cabinet which has a double lock or double door. There should be a proper documentation for narcotics. Like, for example, you take a one narcotic medication, a check documented amount, quantity, and count the actual count that is in the cabinet. This is just a sample to make sure that the documentation is proper. In some hospital, they might have an automated dispensing cabinet, example, the Pyxis, where they keep their narcotics or other expensive medications, or in nursing floors, where they keep all the medications actually inside these automated dispensing cabinet as their floor stock. Now for Pyxis, make sure that there is no medication left on top of the Pyxis machine. That means this is unsecured and anybody could reach to this medication, and this could be an easy citation. For this automated dispensing cabinet, again, as an equipment, it needs to be clinically engineering tested. And there should be a tag stuck to it that you check that has a preventative maintenance, a future date where they will be coming to inspect it and maintain it again. Now, in general, we all know that we should not store things or boxes direct on the floor. And the reason behind that if there is any flood, water might reach to these boxes, or insects, for example. Also, not to reach to the top near the ceiling. There should be a space, and the reason behind that if, God forbid, there was a fire, the fire or water sprinklers will not be reaching the top boxes. So nothing on the floor, nothing too close to the ceiling. In general, avoid storing cardboard boxes. If you are inside the pharmacy putting medications on shelves, remove them from the card box. The card box comes from the warehouse, where we consider a dirty area because these boxes, they were in the street, in the open air. And the pharmacy is considered a clean area. So before you store the medication on shelves in your pharmacy, remove them from card boxes just to maintain the cleanness, and this is an infection control concern. If the medication is flammable, then you need to store it in the approved steel cabinet. Be sure that your medication is, if it is light sensitive, so you store it away from the light. If it needs a fridge, so it is in the fridge. If it is do not refrigerate, you keep it away from the fridge. So each medication needs to know the storage condition. All the staff need to be aware of that. Now, coming to the working area and the equipments that you might be having in the working area. First thing, would like to mention the sink. Sink in your area need to be clean. And be careful if there is any cabinet underneath the sink, make sure that it is empty, nothing is stored under the sink all the time. And it is not enough to tell the staff this, and they are aware of that. Be careful, because sometimes housekeeping might store their things under the sink. So you might be surprised that there are tissues or things stored under the sink. So if you have a cabinet, well, let's close it or label it that clearly nothing is stored under the sink. Make sure that the working area where your staff are working has a good light, the temperature and the humidity are good, and it is not crowded, and there is minimal interruption. Again, going back to documentation, temperature, room temperature and the humidity need to be documented all the time. Now, temperature, it's between 15 to 25. Humidity should not exceed 60%. If you felt it goes out of range, whether the temperature or humidity, immediately call the maintenance. They would come and check the air conditions and fix it. Because as long as this affecting the staff, it also might affect the medications stored in this working area. Be careful also of the medication there, the opened container, whether it is parenteral or non-parenteral. It should have an opening date, expiry date, and initial. And this is one of the citations. The inspectors go directly and check the bottles, the open bottle, and check if it is labeled with the opening date, expiry date, and initial. This most of the time gets missed by the staff. So your role here, when you do the inspection, emphasize on them on that and take samples to make sure that they are compliant with that. Now, if you have equipment in the working area, whether it is a tablet counter or the balance scale, the robots, the smart solutions, all these equipments need to be clinically engineered, maintained, and again, need to be documented, and a tag with a future maintenance date should be there. Medication expiration, it's an important thing to focus on. Actually, all the medications need to be checked on a monthly basis, whether it is opened or unopened containers. They cannot go expired. We cannot keep expired medication. If it happens, when we discover that during the monthly check, they need to be separated from other medication, labeled that these are expired medications, do not use. And then we have to have the proper disposal way. This needs to be done on a monthly basis. This needs to be assigned to the staff, and they should document whenever they are done with their expiration. And this documentation needs to be checked. Keep in mind that you are not checking only the medication in your area. You're also checking all the medication everywhere. You might have emergency kits. You might be having Pyxis in nursing units. So your responsibility is to inspect the medications in these Pyxis machines. Also, if nursing have floor stock rooms, you need to go and inspect their checking. They are responsible to check expiry on a monthly basis, but you go there and you take random samples and also check the expiry of the medication. Documentation, again, whatever you do, whatever your staff do, need to be documented. You know the golden rule. If it is not documented, it is not done. You cannot prove that you did it unless it is documented. For example, if you're doing extemporaneous compounding, extemporaneous preparations, compounding, you need to have a log sheet for that. And this log should be complete. It should be clear, legible, and it needs to be signed by both the preparer and the checker. Same thing when you are doing a serial dilution. Again, documentation is a very important thing. Whatever you do, you need to document. We're talking here about the staff and they're working. Whatever they do, they have to document. Documentation also may be extended. Like you need to document when you visit the nursing units to check the floor stock room, or when you are preparing the code boxes and the staff is updating the code box, filling it, and checking the expiry when they are checking these stocks. So documentation everywhere. I would like to mention here that inspecting magnesium sulfate in the code boxes, magnesium sulfate as a recommendation by the JCI need to be segregated in a plastic Ziploc bag and labeled that it is a concentrated high alert medication, concentrated electrolyte that need to be diluted before use. You need to inspect that and document this inspection. Talking about the safety, we would like to mention here the SDS. I hope everybody knows what we mean by SDS. Make sure when you visit your pharmacy areas that the staff are aware of SDS and what does it mean. SDS is the safety data sheet, which is all the same about the hazardous material that we are getting in our and keeping in our pharmacy. Make sure the staff are aware where is this SDS located in their pharmacy. It's good to have it as a soft copy, maybe in pharmacy webpage or the hospital webpage, but it is important also to have a hard copy in case the system goes down, so it will be easy for them to locate it. Make sure that they know the content of the SDS binder, what's inside it, how they use it when there is a hazardous spill. Talking about the spill, make sure that the areas have a spill kit wherever they have a hazardous material. And the spill kit is located in a place that it is visible to everyone. And all the staff in the area knows where's the spill kit, knows the content of the spill kit, and they get training and certified how to use the spill kit. This is very important. Also, in hazardous preparation areas, like for example, the chemo, make sure that there is a eye wash and shower station. The eye wash and shower station is very important, and there should be a maintenance and the checking of this eye wash and shower station. For example, see the documentation, and this could be a responsibility of any of the staff assigned to check, or the quality person or the safety person. The log of the maintenance of the eye fountain and the shower need to mention that, yes, we checked, there is a running water. The water is clean and clear. The temperature of the water is bearable. It's not too hot, not too cold. And again, the pressure of the water is bearable. Like it is not a weak pressure that it will not help, or not too strong that might harm the eye if it got pushed into the eye. So make sure this is an important information. All the staff are aware and know the location, and there is documentation for the maintenance and keeping of this eye fountain and the shower station. Talking about the safety. Now, fire safety, we all in our hospitals usually on a yearly basis take training, and we go with the section of the safety and security department in the hospital and get a training how to activate a fire alarm, how to use the fire extinguisher, how to evacuate, all these things. But still, there is other details that you need to make sure that all the staff in your area are aware. For example, In their area, each staff need to know where the fire alarm is located. Because God forbid, in a time of a fire and there is a power shutdown, and there is, for example, a smoke or a dim light, it's not a time at that time to look for the fire alarm or to ask others, where is the fire alarm? Same thing with the fire extinguisher. Make sure everybody knows where is the fire extinguisher located. And finally, where is the fire exit, the emergency exit in the place they are working in? The fire exit specifically need to have a sign and it is lit, like it stays light even if the power shuts down. It's very important to check this information with the staff, and they know it by heart. Flammable material, make sure that it is put in a steel cabinet, separated and checked. Lastly, the confidential waste for the patient. Actually, anything related to the patient, any piece of paper that has the name, that has the medical record number, it should be goes to the confidential waste and not the regular waste bin. And this is again things that the inspection would look, the inspectors would look and check. Coming now to a very important part of the inspection, which is the infection control. Remember, we spoke about the IV room and where we prepare sterile preparation under aseptic technique. Well, this IV room should have a separate housekeeping tools. Like the housekeeping should have a carrot or a tools or all the equipment labeled and used only for the IV room. And whatever is used inside never goes outside and clean other rooms. And this is something, again, the inspectors would look for. Hand hygiene. We cannot emphasize more about hand hygiene. Hand hygiene is the most important factor to prevent hospital-acquired infection, which is, again, one of the international patient safety goals. Make sure all the staff knows about hand hygiene, why it is important, and how we can get our hands cleaned. And how is that? It's, of course, either using alcohol gel and check the dispensers in the area, and the other solution, other process is washing hands with soap and water. Make sure the staff is aware how to do it, what are the steps, what are the disinfectant or the soap they're using, and the duration for the hand washing or for the alcohol gel using. This is very important. And they might practice in front of you. They need to be familiar with that, being part of their practice. They do it all the time, and not only before or during the accreditation visit. Of course, in the medication preparation area, strictly no eating or drinking. You make sure when you visit your pharmacy areas that you observe nobody is eating or drinking while they are preparing medications. Now, all pharmacy areas, all the shelves, all the table counters should be clean. All the bins should be clean, properly organized, properly labeled, and there is no overstocking. Overstocking means boxes are on top of each other and outside their assigned bins. Again, under infection control, emphasize on the PPE. What is PPE? Make sure that your staff understands what's PPE, which is personal protective equipment. Personal protective equipment, it varies, it depends on what are you preparing. Well, if you're preparing a sterile product under aseptic technique, then PPE would be wearing a shoe cover a gown, a mask, gloves, and a head cover. If you're preparing a regular medication, non-sterile, maybe gloves would be enough. Gloves or mask would be enough also. Finally, all the staff in the area should be wearing a clean lab coat with a visible ID. Now, this is very important, and a non-compliance to the infection control might lead to unwanted results and might lead to contaminated products that we are doing, and it can be easily prevented by complying to the infection control standards. Talking now about medication safety, and the first thing would come to our minds is the high alert medication. High alert medication, you need to make sure, and by the way, this is one of the essential safety requirements in SBAHI standards, one of the ESR. The high alert medication, you need to make sure, ask the staff that they know what do we mean by high alert medication. High alert medication means it's the medication that have a heightened risk to cause significant harm to the patient if used in error, whether the error is during prescribing or preparation or while dispensing or when administering or even storing or transporting or even monitoring. Let them know the high alert medication in their pharmacy. Let them have examples in mind. Like when we say high alert, first thing comes to our mind, all chemotherapy, all narcotics, all inotropics, all anticoagulants, for example, and insulins, and so on. So let them have these examples ready in mind. Okay, so it's a high alert medication. What should we do with it? Make sure high alert medication has a controlled access. So it's not open for everybody. Like in the nursing units, it have a medication room with security access control. In the pharmacy, it's only in pharmacy where not anyone can enter the pharmacy. High alert medication should be labeled as such on the shelves. It should be segregated, especially if it is one medication with different strength. And of course, the double checking, independent double checking, and this is one of the key strategies, safety strategies that have independent double check, with is two separate healthcare providers do the full checking to the product. Now, again, checking means documenting. If you're not documenting, you're not checking, and you cannot prove it. One of the high alert medication is the neuromuscular blocking agent. In neuromuscular blocking agent, there is a special safety strategy with it, that they need to be stored in the fridge separately in a lidded bin. Like you can just bring a plastic container, but it should have a cover. Not necessary to be locked, just closed. This is an extra step to just to grab the attention that this is a neuromuscular blocking agent. This box should be labeled as a paralyzing agent, high alert medication. It causes respiratory arrest. Use with caution. The next is the LASA medication, which we call it like the twin sister of the high alert medication. The LASA medication, again, make sure that your staff knows what do we mean by LASA medication. This is an abbreviation everybody use. They rarely say the whole long sentence that it is look-alike, sound-alike medication. Now, what are these medications? These medications that either sounds alike by name, it's a confusing name, or they look alike, whether by packaging the vial or the box itself, or even when reading the name itself, they look alike. Now, what should we do with the Lassa medication? Again, make sure that the staff are aware and they have examples in mind. The famous examples like dopamine, dobutamine, the Losec and the Lasix, cyclophosphamide, cycloserine, and cyclosporin, for example. So make sure that they are aware and you have in your policy a clear safety strategy how to handle that. Now, for the Lassa medication, of course, the first safety strategy is to separate the Lassa pairs from each other. And for the confusing names, you use the Tolman lettering. What do we mean by Tolman lettering? Is for the similar names or confusing names, we take the different letters and we write it in capital letter. We do this on the shelves, on the computer, on the label printed for the medication, and so on. And for these medications in your area, you should have a list. Same thing with the high alert medication. You should have a list. This list needs to be annually updated and it needs to be posted. In addition to having it as an attachment to your policy or on your pharmacy webpage, you still need to print it and post it, and all the staff need to know where is it located, and it should be easy access for them. It is very important that the staff will know where are these lists, whether the high alert medication or the Lassa medication. Lastly, under medication safety, we come to the cytotoxic or the hazardous drugs. Now, cytotoxic, of course, should be labeled as such. They need to be stored separately. The hazardous, same thing. There should be a hazardous label or a caution signage. Now, do you know what's the difference between hazardous and high alert medication? High alert medication, if there is any error in any of the steps of medication management, the harm would go directly to the patient. While the hazardous medication, if there is error in handling, it might harm the staff himself. So that's the difference. A medication could be a high alert and hazardous at the same time. Example, cytotoxic medications. Hazardous could be different categories, not only cytotoxic. It could be anti-neoplastic, non-anti-neoplastic. It could be affecting reproductive system. If the staff is in an age that bearing a child, like they are planning to have a children. Hazardous could include also the live vaccines, the chemicals in your area. So you need to know in each pharmacy, they should have a list of these hazardous medication. They need to know how to handle it, how to act when they need to prepare it, where to dispose it, and the labeling would help them on the shelf, would help them to remind them how to handle these hazardous medication. Now, speaking about all this, this is what we're gonna inspect in our areas as a preliminary preparation for the accreditation or for the inspectors. Now, in order to do that, what do we need? What are the inspection tools that would help us to do this? Well, actually, doing the inspection would need people, and you need to have a process to do that. And of course, you need paper, which is documentation. Now, it is not that simple. Sometimes you will face challenges. For example, you need to have a team. So it's not only the job for the quality person or the safety person in your pharmacy to do that, especially if you are a huge hospital and you have too many pharmacies, they cannot do that alone. So if you have a team, the team commitment comes here as a challenge. The team are regular staff that they do other things, so they are too busy to do this inspection if you ask them to do that. The other challenge might be is the inspection quality. Like you ask them to go and inspect to help you other pharmacy areas, but are you sure of the quality of their inspection? The third challenge you might face is the compliance of the pharmacy areas with the standards and with your recommendations when you visit their areas and you find gaps that need to be fixed. In our place, how we overcome these challenges? Well, actually, we increased the number of inspectors. We made a big team that each inspector would go and inspect a different pharmacy area. And these inspectors that we chose are voluntarily want to join us, and they are holding high positions in the pharmacy, like they are either managers or senior pharmacists in their areas. So they have a flexible time, kind of flexible time, to go and inspect other pharmacy areas. When they do that, this is a double benefit, because the gaps they will see in other areas, they will come back to their pharmacies and make sure it is not there, or if it is there, they will fix it. Also, we gave them an adequate training. First they join, they will come with us, with the quality or the safety team. They will come just as an observer. And the second visit, they will go, they do the inspection under the supervision of the quality and safety team. The third visit, they will go, they will be on their own. We can increase the training till we are sure that they have confident to go alone and they have a good eye to catch the gaps in the areas. What else we did? Actually, we distributed the checklist to all the areas. We encourage them to do self-audit, self-check. So now they know when we come to their area what we will be looking for, so they can fix it and correct it and be part of their regular process. Also, when we did an inspection and we write it in the report, we shared the report with everybody, with all the inspectors team we have. We forward the report to the manager of the inspected area, to the senior staff, to the head, to the director of pharmacy even. And this is all supported with evidence photos. So they would understand what do we mean when we write a comment or finding. We ask the inspected area to have a corrective action and reply within 14 days. So it's not just they will receive the report and that's it. They have to fix things and report back to us. Lastly, we visit this checklist from time to time and we update it continuously, especially if there is any new recommendation from Sabahi or from JCI or anything that we noticed keep happening in the areas. So we add it to the checklist so we will not overlook it. We also put a team schedule, like we distributed the pharmacy areas among the volunteer of inspectors in our pharmacy. And we revise it annually. We switch among us, so not a one person keep going to the same area. We change, we switch on an annual basis. So every year we visit different areas to have different eye. So we'll not get used to the area we are visiting. Lastly, we created a log sheet for the visit just to monitor who's going and who's compliant with these inspection and if there is any area is missed or not, so we can catch this on time. I would like here to share with you a sample of a pharmacy area inspection sheet. This is, for example, you put the date, the pharmacy area, and the inspector name, and you list all the standards you would like to check in the area. Now, some areas would have the standard, for example, not applicable. So you will have a space here that you can shade it with the gray if it is not applicable, like if the area doesn't have a hood, for example. So you shade the whole thing here. The other column is for compliant. If it is yes, that's good. If it is no, you write your comment. Why it is no, what was your citation? What is the gap you found? And if there is any supporting photo, you attach it to the report and you say, see attached photo. The last column is for the area feedback. And this is to put their action plan and how they fixed the citation. And this is not to give an excuse of why they did what they did. This is the action plan of fixing. And by this, we would like to come to the end of the session. We would like to have at the end, like a conclusion. If we want to summarize what we shared today, it's just that have the inspection, self-inspection is better to be done, to be part of your work, and it reflects a daily practice. We would like to emphasize also on the documentation. It's an important as the action itself. The small gaps can lead to major findings. We would like to encourage the areas to have a routine self-audits, to hold staff accountable for their work, and to always listen to the recommendation and citation for continuous improvement. So in order to have a proper inspection, you need to list all the standards, know the criteria, understand it, have a skilled inspector teams, a proper training, give them proper tools, and document these inspection in the checklist, and do regular audits and reviews. With this, I would end the session. I hope you enjoyed it, and the floor is open for your questions.
شكرا دكتورة فرح على الشرح الجميل والمعلومات القيمة اللي احنا استفدنا بيها النهاردة. في أي حد من الحضور عنده أسئلة؟ دكتورة فرح معانا هتجاوب عليها. دكتورة فرح حضرتك سامعاني؟
Yes.
تمام. في أي حد من الحضور عنده أي سؤال؟ طيب تمام. هو الايفنت ان شاء الله بشهاده حضور مجانيه بعدد ساعتين هنقدر ان شاء الله نستخدمها في تجديد الشهادات المهنيه. بس احنا عندنا في الشات بوكس بس رابط اعلان الايفنت على لينكد ان او على فيسبوك على حسب السوشيال ميديا اللي معانا. ندخل بس نعلق على البوست علشان نرسل ان شاء الله بعد الايفنت مباشره رابط الحصول على الشهاده من على الموقع. في اي سؤال تاني؟ اي اسئله؟
So I believe if there is no question, I hope the session was clear and you enjoyed it, and it will help you in doing the self-inspection in your areas. Thank you very much, everyone. Thank you for listening.
شكرا دكتوره فرح.
شكرا دكتورة. وفي ختام إيفنت اليوم نتقدم بخالص الشكر والتقدير للدكتورة فرح شهاب على طرحها القيم ومشاركتها العلمية الثرية. كما نشكر حضوركم الكريم وتفاعلكم المستمر واللي دايما بيكون هو الدافع لنا لتنظيم المزيد والمزيد من الإيفنتات. نلقاكم بإذن الله في فعاليات مجانية قادمة، والسلام عليكم ورحمة الله وبركاته.
شكرا لحضراتكم جميعا.